I'm delighted to welcome Baroness Delyth Morgan from the Breast Cancer Campaign, your Chief Executive of the charity. And I know that you raise funds so that research can be done, so hopefully one day we can find a cure for breast cancer. That awful moment when you find a lump in your breast and you feel that the world is just about to collapse all around you. Talk us through that.
Let's remember, there are 48,000 women diagnosed with breast cancer every year, but many, many, many more women who find a lump or find something unusual in their breast will actually be given the all clear. So I suppose the first thing to say is that it's about 9 out of 10 breast lumps turn out not to be cancer. So although it's very hard for a woman who's going through a period where they might be thinking they've got a lump that's worrying, that there is a really good chance that it won't be breast cancer. So
9 out of 10, that's a really good
yeah.
statistic.
Yeah.
I like
Yeah.
that because you do imagine I found a lump, therefore I'm going
Yeah.
to die, and it actually
Yeah.
isn't like that.
Yeah, absolutely. And that's why it's so important that if women do find something different about their breast, that they do have the confidence to go and see their GP and ask for further investigation.
And how urgent is that?
Well, what the kind of routine referral would probably be about 2 or 3 weeks. But if the doctor thinks that there is something urgent, then you can be seen very quickly. In some places, it'll be in a matter of days. But there is evidence, and it's pretty clear that some waiting is not going to do any harm. The problem is it's very stressful for women. If you find something, and let's be clear, what you need to know is you need to know what your breasts are normally like. Mm-hmm. So we all, will experience changes in our breasts, either, if we're, premenopausal, then, as the month goes past, then our breasts will change. And then as we get older, our breasts change as well. So knowing what's normal for you, and then if you do find something unusual, whether it's a lump or maybe kind of dimpling of the skin, or the nipples maybe change position, or you find something, one breast is a different shape than normal, then you should maybe see your GP and ask for them to refer you, or ask them for advice. Okay. But it's about being confident in what's right for you, and confident to feel yourself as well.
Yes. Now, premenstrual is just okay, it's a monthly cycle, and your boobs do get bigger, and they can become more tender, and all sorts of lumps and bumps appear, presumably. And so you're saying that's one thing, and also as we reach menopause, that's sort of another sort of time of our life when changes can happen, and so that's another thing. So the things that we should really be looking for, self-examination is obviously something we should do once a month.
Well, I think for some women to do it that often might make them feel anxious. Okay. The research to say you must do it in this way or that way is not as conclusive as you would want it to be. So I think the advice for women has got to be to know what's right for you, to keep in contact with your body, and if you notice any changes that are not normal for you, to go and seek help. But there's really one very important piece of advice which women should take note of, and that is if you are invited for screening, then really think about going, because I went for my first screening appointment recently, and it was a little bit uncomfortable for a few moments, but it wasn't a problem, and I have the comfort of knowing that I'm being screened for breast cancer, and it's just part of just looking after myself. And then because
it's a free service.
It's a free service, absolutely, and the risk of breast cancer increases with age. As you get older, then you should take note and look after yourself.
Absolutely. Now, I'm going to talk about my own bust here now, and talk about my experience of going for a mammogram, because I'm gone through the menopause and I'm on HRT, and my boobs are bigger now than they've ever been, which is great. I enjoy that. But in my earlier days, when I would go for a mammogram and they weren't very big, I was sort of thought, how on earth are you going to get them into this machine that sort of in effect squeezes your boobs together like a ham sandwich? And how on earth are you going to see anything in there? Because there's not a lot. But so what are they looking for when they do that?
That's a really good question, because what they're looking for is the breast tissue, and the breast is a gland, and so they're looking for the ducts and the kind of lobular tissue, which looks a bit like a tree, an upside down tree.
Okay.
And so if you're small breasted, they can do it. They're very experienced. They can get you in and get the right kind of angle, and they take a number of different shots, and so they do get everything in. And what they do now, and a lot of places they have digital mammography, and they will then look at the picture while you're there, and that's what they did to me. They look at the picture and make sure they've got the right picture before you go even.
Oh, I see.
And so it makes it all much more convenient. So
Yes.
in the past, more women have been called back maybe because the photograph wasn't quite right. They hadn't maybe positioned the breast properly or whatever.
Okay.
But now with the new digital mammography, it's much more efficient.
More accurate and efficient, isn't it?
And they can keep the pictures and compare them over the years very quickly.
Of course. Yes, that's good. I mean, the world has moved forward so much, hasn't it? Which is incredible that we're sort of here now. Now, the things that we should, sort of golden rules of, yes, you can feel your breasts and you can know if there's a dramatic change. One suddenly gets bigger, or you start bleeding, or there's some secretion coming from the nipple or something. What are the other big signs that you should look for?
Well, obviously, a lump. Nipple eczema is something that doctors are concerned about. So if there is an unusual discharge from your nipple, or a change in shape, or the nipple becomes pulled in, then that's something that you should look for. Or a dimpling of the skin, and a kind of an orange peel type.
Like cellulite looking.
Yes, only you wouldn't expect to see that in your breast. But again, it's about a change.
Yes.
So and being in tune so that you know what's normal for you.
Okay, and what about pain?
Well, that's a difficult one, because some women do talk about how they've had pain with their breast cancer, but a lot of women say they haven't had anything
That's unusual,
at all.
Isn't it? I mean, just relatively speaking, I've understood it that if it's painful, that's unlikely to be.
It's unlikely, absolutely,
Yes.
and it's more likely to be something like your monthly cycle and
Yes.
fluid retention or something like that. But it's a difficult one. But you see, that's what our GPs are for, and so we need to feel confident as women going to see the GP and talking about it. And of course, the other thing, which is really difficult to take on board, is the fact that a very, very tiny number of men get breast cancer.
Of course.
And
yes.
That's not something any man would ever expect.
No, they
and there's only 300 cases a year, so it's
Really?
very, very difficult to identify.
Of course. Fascinating stuff. Thank you very much indeed. So the golden rule is basically anything that's out of the ordinary, get it checked out.
Absolutely.
Thank you very much, Delyth.